Have you ever wondered why so many babies today struggle with developmental disorders? And if there is something we could do about it before conception or during pregnancy? You are about to learn the truth, and it's far more hopeful than you think. Hi ladies, I am Dr. Disha MD, your holistic gynecologist, founder of TruHealing. I help women create vibrant hormonal balance and healthiest possible babies using a holistic, functional and integrative root cause approach. In today's video, we are going to dive deep into a crucial question: how did we get here? Why are so many children facing neurodevelopmental disorders, and how can we change that story? Welcome back, ladies. This part is about our journey into understanding your baby's brain development. Now, in earlier videos, we explored what neurodevelopmental disorders are and how inflammation in the brain can affect growth. Now, in this part, we are asking, how did we get here? Why are we seeing such an epidemic of developmental disorders in today's kids? And here's the key. There are two kinds of risk factors. Non-modifiable means the things we can't change, like genetics or age. But thankfully, there are modifiable factors also. Modifiable things like we can influence with our lifestyle, nutrition, and environment. Now, common misconceptions, you may have heard people say that, oh, it's just genetics, or some kids just get it, or maybe the cause is unknown, idiopathic. But that's not the complete truth. Yes, genetics can play a role, but research now shows that environment and lifestyle have a massive impact. And here's the hopeful part. Your genes are not your destiny. We have this fascinating science called epigenetics. Think of your DNA as the blueprint of a house. And epigenetics is like the architect deciding whether to follow this blueprint or make changes. So your lifestyle, your nutrition, even environmental toxins can literally switch your genes on and off, including those linked to autism, ADHD also. It means your choices during and before pregnancy can strongly influence your baby's brain health. Let's talk about risk factors now. So the number one risk factor, the age of parents. The risk does increase with age, about 20% per decade after 35. Not something we can change, but good to know. While we cannot change your chronological age, we can change your functional age with the science of epigenetics and regenerative functional medicine. We can improve your egg quality, which is the most important marker and foundational for your baby's brain health. The second risk factor, the fertility treatment, ART, research suggests that about 35% increase in autism risk, but that may partly be due to the age. Again, not your fault, not in your control. Number 3 is maternal obesity and high blood pressure. Now this is a big one. Maternal obesity increases ADHD, autism because it promotes inflammation in the brain like tiny fires that disrupt the brain wiring. High BP, whether before or during pregnancy, can also increase the risk. Now if you're already pregnant, we focus on controlling inflammation. If you're preparing for pregnancy, now this is the time where lifestyle changes matter the most. Now, the number 4 risk factors are your family history and autoimmunity. If there's a history of autoimmune conditions like Hashimoto's, rheumatoid arthritis, or type 1 diabetes, the risk is higher. Now, this isn't just genetics, inflammation passed down too. Personally, if you have an autoimmune disease, it's very important to manage it very well and fixing it from the root cause. Number 5 risk factors is hypothyroidism. Low thyroid hormone can also slow down the brain development, affecting the neuron growth, migration, myelination. And that is why I recommend early thyroid screening in pregnancy, even though standard guidelines often skip it. Remember that prevention is more powerful than cure, and your thyroid needs root cause healing, not just thyroid pill. Number 6 is maternal mental health. Depression itself and certain antidepressants have been linked to developmental disorders. Now, this doesn't mean that you should stop your medicine suddenly. Please never do that without your doctor. What it does mean that your mental health needs as much care as your physical health. Nutrition, movement, stress reduction, all these can play a huge role. Number 7 is infections during pregnancy. Now, sometimes infections trigger inflammation and that alters baby's brain wiring. Again, not modifiable, But if this happens, it's even more important to focus on gut health and calming inflammation afterwards. Now, here's the big picture, ladies. Some of these risk factors are out of our control, but many, like nutrition, inflammation, mental health, gut health, toxins, these are all the things we can change, and that's where our power lies. So don't feel fear when you hear these risks. Feel empowered, because knowledge is power, and by knowing where you stand, you can take action on what matters most. And remember, ladies, even if you have risk factors, your baby's destiny is not fixed. The way you nurture your body, your mind, and your environment can help your baby thrive. So in next video, we will go deep into exactly what can you do to balance the scale, reduce the risk, and build the healthiest brain possible for your baby. Stay with me. The best part is coming.